The CRIES or CRIES mnemonic is a systematic approach used by healthcare providers to identify possible medical causes of excessive crying in infants. Each letter corresponds to a specific category of conditions that may lead to significant distress. Infections. Infections are an important consideration in infants presenting with persistent crying. Conditions such as urinary tract infections, meningitis, and sepsis are potential underlying causes. In some cases, fussiness may be the only clinical symptom of these serious infections. A high index of suspicion, combined with appropriate diagnostic tests, is essential to identify and treat these conditions early. Trauma or hair tourniquet syndrome. Trauma encompasses both accidental and non-accidental injuries. Fractures, subdural hematomas, and other injuries may lead to unexplained pain in infants. Non-accidental trauma, including child abuse, should always be considered, especially if the crying is accompanied by physical findings that cannot be explained by the provided history. A detailed history and thorough physical examination are fundamental in such cases. Hair tourniquet syndrome is a rare condition that occurs when a strand of hair or thread wraps around a body part, cutting off circulation and causing pain, swelling, and sometimes discoloration. Cardiac disease. Cardiac disorders such as supraventricular tachycardia or myocarditis may present with symptoms like irritability or feeding difficulties. Additional findings may include tachypnea or poor weight gain. These clinical features warrant further evaluation to rule out underlying cardiac pathology that may require intervention. Reaction, reflux, or rectal. Adverse effects related to medications, as well as other conditions such as gastroesophageal reflux or rectal and anal fissures, can cause significant discomfort in infants. Careful assessment of the infant's medication history and feeding patterns can provide clues to these causes. Intussusception. Intussusception is a condition in which one segment of the intestine telescopes into another, resulting in bowel obstruction. It often manifests as episodes of intense abdominal pain, during which the infant cries inconsolably. This condition is a surgical emergency, and prompt recognition and intervention are critical. Eyes. Eye-related problems, including corneal abrasions, foreign bodies, or congenital glaucoma, can cause pain and irritability. A detailed examination of the eyes is important if ocular symptoms are suspected, as such conditions are frequently overlooked in infants. Strangulation or surgical processes. Conditions involving strangulation, such as hernias or testicular or ovarian torsion, can lead to severe pain and require immediate surgical intervention. Early diagnosis is essential to prevent complications associated with these conditions. Conclusion. The CRIES mnemonic provides healthcare professionals with a structured framework for evaluating excessive crying in infants. By systematically addressing each category represented in the acronym, clinicians can identify underlying medical issues that may require prompt attention. Before diagnosing colic or other common conditions, a comprehensive history and physical examination are imperative to rule out serious medical causes.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.